Hi, friend. This is Dr. Apoor Mehra, and with me is a phenomenal orthopedic surgeon, Dr. Jitesh Mangwani. They say that you have to choose your path, you have to look at multiple stops, but finally, if your eyes are set on the goal, nobody can stop you. Jitesh has graduated MBBS from MUHS Nasik, subsequently went on to do MS Orthopedics from LTMC Sion Hospital, Mumbai. Just to tell the viewers, Jitesh has been a topper in the NEET exam and he took that seat through All India and then went on to become an associate consultant for 1.5 years at the prestigious KEM hospital. You know, the hunger in this man I've been witnessing, it's, I think, almost a decade now. Knowing him has been growing. You know, he's hungry for more and he is true to the statement. If you really want to escalate up in life, education is the best tool for it. He went on subsequently to chase his dreams, to fellowships in the best institutes, not only in the nation but internationally, and now finally has found out what he wants to be called as. Jitesh Mangwani wants to be known as a spine surgeon. Let's hear him out what he has to speak on this conceptual talk with the heart. Welcome, Jitesh. Over to
Thank
you.
you, sir. Thank you for this amazing introduction. So, friends, I would like to tell you something. Once you're done with your orthopedics, there is always a hunger to do the fellowships, to do the super specialization, since there are no proper set courses of MCH after orthopedics. Yes, there are courses abroad, but what we exactly want to know is what path are we going to create for reaching that super specialty course, especially in India. Fellowships is the answer to that. Now, always we are confused of what fellowship should we be exactly taking. So, the answer to this is that in your 3 years of orthopedics, you have to see and decide what exactly love are you developing for. Knowing thing is that you are going to have two-faced minds and being confused is completely fine of what super specialty you want to do, because this is something that you are going to do for your life. Being confused is no harm. Yes, there are people who are definitely sure of doing something, but you shouldn't be disheartened by that, thinking that since you are in a state of confusion. So, to tell you in brief, I started my journey doing fellowships for arthroplasty and then subsequently shifting to spine. When I was done with my orthopedics, at that time I got the opportunity to do it from Sion Hospital, which is in Bombay. So Sion Hospital basically focuses primarily on spine surgeries. All my mentors over there were primarily doing spine, so I was bound to have some love for spine. At the same time, I did want to explore the option of arthroplasty and arthroscopy. That is when I topped the university, joined KEM Hospital. My mentor over there was doing arthroplasty and arthroscopy. I was blessed enough to have that experience as well for 1.5 years, wherein I was doing independent surgeries as well. But it is important to do fellowships. Fellowship is important so that exclusively those surgeries are done so that you're sure whether you like it or not. After my tenure in KEM, I got the opportunity of working in Wrightington and Wigan, that is in the UK, and that is one of the mecca of arthroplasty in the world. But my commitment over there was supposed to be for 3 years. At that time, I wasn't like sure completely whether I want to do arthroplasty or whether I want to do spine. It was hard, but that time I gave away that opportunity. I joined a fellowship program in India with a high volume center in arthroplasty and arthroscopy. Every day, the OT list consisted of doing at least 20 joints. So I had a good experience in there. That is when, towards the end of fellowship, I made up my mind that arthroplasty is something that is good, that is amazing, but possibly something that is not meant for my palate. That is when I became and I joined the other prestigious institute in India, in Delhi, that is MAMC, Maulana Azad Medical College. Over there, after even leaving my post as the associate consultant, I joined up as a senior resident. I never was ashamed of doing that. I joined up as a senior resident. I worked in the spine unit for 6 months. I became completely sure of my love for spine. I then gave my entrance exam to the fellowship exam in India and I came rank one in that. That is when I joined the Indian Spinal Injury Center as a fellow. Now, as the reason of telling you this journey is that hitting and trying something to be completely sure of what you love is pretty much important. Something that you're going to do at least for the next 30, 40 years, you have to be sure you love it or not. Things when you get confused are basically because you may be getting inspired by some people. There is no harm in that. Drawing inspiration is good, but you should be sure of what you love. Just because some person is exceedingly doing well in one of the fields, that is not the answer that is meant for you. You should be sure of what you love, and that is what you should pursue. I will also like to give you a small uh, orientation on how to go about the fellowships in spine in India. So, ideally, if ever you want to pursue the fellowships abroad, the general tendency of people abroad in all the countries after you go from India is that you are highly respected and you get good options in case you have done a long term fellowship in India. The definition of long term is anything that is more than 1 year. At least 1 year is required. That is when you will be considered for good fellowships there. The different options in India via the entrance exam is the Association of Spine Surgeons of India and FNB exam. These two offer the fellowship of 2 years respectively. Now, Association of Spine Surgeons of India, they have approximately 7 to 8 centers wherein they have multiple seats, and FNB has got a wide range of cover through India. FNB is a centralized system, so is ASSI. Now, the ASSI fellowship, it's not FNB or DNB recognized, but it is highly respectable for the reason that it is made by the senior most people in India. And currently, ASSI is a joint member of German Spine Society, Korean Spine Society, Australian Spine Society, and also it's one of the key members of Global Spine 20 that is being formed. When we talk about ASSI on an international platform, it's highly respected. After that is the FNB, as I told you. Now, apart from this, there is one other body that is the Indo American Spine Fellowship or the IASA fellowships. They have a fellowship program of 6 months, out of which 5 months are in India and 1 month is abroad. That 1 month tenure has to be decided by you amongst the multiple options that they give you from the US fellowships and the UK fellowships. The other option is the AO fellowship. AO fellowships can be short term or long term. Short term can be as small as a week, long term can be as long as 1 year. I will advise if people are going ahead with AO fellowships, you should possibly aim for a 1 year fellowship. Now, the other important thing with AO fellowship is that you have a prerequisite of doing any of the AO courses beforehand. So, I will advise if you are aiming for AO fellowship, you should be doing any of the AO programs beforehand so that that criteria is taken care of. Along with that, you have to be a AO member. So if ever you are not yet an AO member, sign up for it that immediately. Now, the other advantage with IASA fellowship, that is Indo American fellowship and AO fellowship, is that there is no entrance exam. All you want to do is apply, send in your CV, interviews will be done, and accordingly things will be decided. If you want a streamlined process after the exam, ASSI and FNB is the answer. The various institutes in Delhi who are leading in the fellowship training is the Indian Spinal Injury Center. In South is the Ganga. In West is the Bombay Hospital. And in Kolkata is Dr. Somyajit Basu's Center. Now, the other fellowship which are not associated with these organizations and still are the leading in India are Dr. Shekhar Bhojraj's fellowship that is in Bombay, Dr. Ram Chadda's fellowship that is in Bombay, and Dr. Bharat Dave's fellowship in Gujarat. They offer amazing hands-on and amazing work and amazing teaching, no doubt about it. But you have to apply, and after the application, there are interviews after which it is decided which candidate will get through. They offer the fellowship ranging from 1 year to 2 years to even 3 years. So it is not hard and fast. It is as per what you apply, you can get through. But if ever you are aiming for spine, my friends, I will like to tell you one thing. If you are aiming for a spine fellowship abroad, please do a long-term fellowship in India. That is how you will guarantee of getting a very good center and a good seat for fellowship training purposes abroad. The other thing I would like to tell you is that there are even more super specializations after spine, that is pediatric spine, oncology, and things like that. So, if ever you want to pursue things like those, even minimally invasive, it is important that you do a long term fellowship in India first. So, my friends, I would like to advise you that in case you are targeting spine as a super specialty, then you should be targeting the long term fellowships in India. That is how your way to get good fellowships abroad becomes easier. Now, apart from that, there are centers like Indian Spinal Injury Center who even offer the honorary fellowships. These fellowships are not paid as such, but you can extend that and make them long term if that is convenient for you, because they will also give you the edge so that you can continue the fellowships for 1 year without any entrance exam, and your criteria of doing a long term fellowship possibly can be fulfilled without any entrance exam like this as well. Now, one important thing for all the candidates who want to pursue spine is that, my friends, be sure. Being sure of pursuing spine is very much important. If ever you are in a confused state of mind, be sure first. This is for the reason, if you are pursuing spine, in that case, you actually leave orthopedics. You leave all the other part of orthopedics and you are just focusing on spine. There are many arthroplasty and arthroscopy surgeons who definitely do the general orthopedics on the side. But in general, after doing spine, it becomes a bit tough. Possibility is there. Doing definitely can happen. If you want to do that, you can do that. But the general advice that I will give you after this particular experience is that if ever you're pursuing spine, be sure of it, because collaborating with general orthopedics after doing spine generally is a bit difficult and also a bit confusing. So if ever you are pursuing spine, be sure of that, because you have to leave everything, whatever you have learned for 3 years, plus if ever you're doing SR-ship or whatever experience you have back, and then go into a new thing altogether. Hence, I will advise you, be completely sure of what you do. Being confused is fine. Being confused, in fact, is better, so that you can be more sure of what you want to do further, because you are going to put oddly 30, 40 years of your practice. So I don't think that if ever you hit and try other things, there is anything bad. Because with my 6 months of trial of my arthroplasty fellowship, at least now I'm sure and I don't have any regrets in my mind. Because whenever I think back, I am now 100% sure of what I want to do in my life. So if you are confused, do short fellowships, be sure of what you want, and then pursue for long term fellowships, because that will be a key for your success. Now, what and if are two very harmless words, but if you combine them together, what if they have the power to haunt you for your life? So if you look back and think, what if I have, done a short fellowship then and decided, that may haunt you. So hence, don't let this thing haunt you for your life. Be sure, take long-term fellowships and succeed in your life, my friends. If you have any query, I'm always there available to answer you, to help you, and Dr. Apurva is also there to help you, because all we try to do via conceptual is to help out all the candidates, because this is the best way to reach out to all the candidates through India, so that there is no confusion and a streamlined process is set with respect to teaching as well as even guidance of what to do after orthopedics. Sir.
Jitesh, I have two questions to ask.
Yes, sir.
Question number one, when you are doing spine,
Yes, sir.
you do have an overlap with neurosurgeons.
Yes, sir.
How big do you find it as an issue in the future in your practice?
Okay, so I will like to give you an example and answer this as well. Many people ask this, and honestly, if ever you ask me, I don't feel that at all. See, the thing is that the proportion of patients versus the proportion of surgeons that is there is pretty much different. When we talk about spine, the proportion of patients that we cater to is pretty much high, and the patients are sensible enough these days. They go to neurosurgeon if ever there is an intraspinal pathology. If ever there is a pathology in the spinal column as such, that it has to be taken care by the orthopedic surgeons. So if ever the question is that how much competition or how much scare I feel with respect to the overlap, the answer is no. Yes, but we definitely do need their help, because in many cases there is a overlap. So they come, they do the intraspinal work, that is the work inside the spinal cord, like if ever there's a tumor excision, but the stability of the column is given by us. They also, if we talk about the neurosurgeons, they believe in the surgery without the implant. So there are failures, long-term failures, short-term failures with that. So understanding of spine biomechanics is not possible, yes, but understanding the intraspinal lesions definitely is on the higher side. But understanding spine as a whole, which guides the biomechanics of the body and the weightlifting, is not possible, which is very well understood by the orthopedic spine surgeons. So I don't feel at all there is any fear of overlap at all. In fact, working in harmony pays off better.
Right. So you mean to say it's a work that can be taken care like a hand in a glove situation.
Yes, sir, completely.
My
And
second,
sir, one more thing I would like to add. The same scare is also there when it comes to arthroplasty, because as they say, the general orthopedic surgeons have been, kind of coming and doing the arthroplasty work. So the same fear of overlap lies there. If we talk about oncology, orthopedic oncology, similarly, the general orthopedic surgeons even do small benign cases like GCT. So the small amount of overlap is always going to be there, but this is one overlap which is highly somehow spoken about. There is a lot of smoke and the fire is actually very much small.
the second question I have is many people are fearful about spine surgeries. I'm sure you are able to handle it. But what are the advancements occurring in the world which will come to India very soon as compared to the spine surgery? So we can advise our young orthopedic surgeons to actually go for fellowships of spine abroad. Is there something that is there which you can get to our mother earth back? Anything that is developing in outside world which can come in, because they say that if you learn a technology, a technique ahead of your time, right, it's like an early start in a 100-meter race. So do you think there's something which is there in
Yes,
the Western
definitely. There
lab?
is always a scope of improving and improvising, and that stands true for everyone. As of now, in case we talk about the newest advances in spine, so the major newest advances is use of robotics in spine. As of now, in India, primarily only one center in Delhi, that is the Indian Spinal Injury Center, is having it. And still, we are in the preliminary stages of doing the work. Now, if ever you want to ask me what is ahead of time, so the being ahead of time will be being hard and fast and completely being, more accustomed to usage of the robotic technology, because robotic technology involves a lot of experience when it comes to registering the portals, because that is how we can minimize the error. So definitely one thing, the centers abroad who are just doing exclusive robotic work, definitely there is a lot to learn from them to minimize the errors and just do high-end robotic surgeries. Apart from that, other thing that I can say is that UBE, that is the endoscopy, that is being developed pretty much faster in the Western countries as compared to India currently, and that is primarily in the Korean countries. So that is one thing. That other I would like to tell the candidates that endoscopies in spine is coming up very much fast. So if ever you want to learn something that can you be exclusive in India, that is the other key, because currently there are very few endoscopy surgeons and endoscopy is coming up in India big time. So if you think ahead of time, robotics and endoscopy are the two things which you can aim forward to.
Thank you very much, Jitesh. So this is what I understand from this talk. Number one, it is never too late to chase your dreams. Number two, if ever you choose a branch in which you don't find your interest, go for something which you will find your interest definitely. Settle in the long term only in something that you see your passion developing into. India has everything possible. It's just the multiplication factor. But robotics and endoscopy are two additions to the existing platform that we have. And you have always been a rocking speaker.
Thank
Thank
you,
you
sir.
very much for sparing out time.
Thank you, sir.
May God make you more powerful. and may God bless you. Thank you very
Thank
much.
you, sir.
Bye-bye.
Thank you.